Hi, I'm Joe DiMatteo, pharmacist, board certified in clinical nutrition, doctor of naturopathy, homeopath, co-host of the Len and Joe Ask the Pharmacist radio broadcast, along with my partner, Len Bransowitz. Thanks for tuning in and thanks for being with us again today. Talk a little bit today regarding energy, our sluggishness. Why are we so fatigued? Why are we so sluggish? Why are we so tired? Why do I have a lot of other symptoms, of which I'll go through for you in a few minutes, but a very common problem. As a matter of fact, in September of 2011, we will have a seminar talking about why am I so tired. Many folks have some clinical overt symptoms of low thyroid function. Today we will focus on one singular aspect. There are multiple aspects, one of which we did deal with, the adrenals. But this one will focus just on the thyroid. Why am I so tired? Why am I so fatigued? Why do I have PMS the way I do? A lot of other potential issues, but let's zero in just on thyroid today. Let's talk about thyroid function. Clinical aspects of low thyroid function would manifest with things such as very dry skin, hair that is brittle and that is falling out. For women, enhanced premenstrual syndrome issues, vertigo, tinnitus, a sense of weakness, cold hands, cold feet, a lot of those types of symptoms. Even mood disorders, even depression is associated with issues with thyroid dysfunction or low thyroid function. I think the issue here is today that what we want to cover is not so much when it's overt. You know, folks are treated medically, they're treated for overt clinical hypothyroidism. In many cases, they respond to the treatments. In many cases, the synthetic or the levothyroxine, the T4 version of thyroid that is used for folks is fine and they do okay. And a lot of their symptoms remediate, their energy's better, they feel better, skin's not as dry and as coarse, hair is better, stops falling out, not as brittle, nails not as brittle, etc. And they do okay. There's a portion of folks that don't do okay. They go on to those versions, and I'll explain why later, we believe, Len and I, and they don't do really well. Their symptoms don't improve. And the physician tells them, well, your labs are fine. But yet they don't respond clinically. They don't have a manifestation that is positive clinically. On the other side, there's a subclinical category. And by subclinical, I mean folks that are falling through the cracks. They have labs, blood work that looks, quote, on the surface perfectly normal because most physicians are absolutely just monitoring a T4 level or, just a TSH, not a T3 and not free T3s. And in many cases, not free T4s. I want to get real technical with you, but you need to know there's some basic parameters. So let's go back. You could have overt black and white clinical hypothyroidism. You have many manifestations. You have many physical symptoms. I don't feel good. I'm tired. I'm fatigued. I have all these physical manifestations. I get onto a prescription, medication, 3 weeks, 4 weeks, 6 months. I feel better. Many of my symptoms remediate. Premenstrual syndrome, vertigo, dizziness, lightheadedness, dry skin, coarseness, all that goes away. The other factor is some folks get onto these medications, doc tells them their labs are good, they don't clinically manifest. The third area, which I want to zero in on right now, is the subclinical, where they're not diagnosed. Like a doc will then tell you, a physician will tell you, very black and white, traditionally medically trained, not that there's anything wrong with this. Well, your thyroid, your thyroid stimulating hormone, TSH, is normal, or it's in a normal range, therefore you don't have any issues. What Len and I do, and some of the physicians we work with, and even Dr. Zelke that we work with here, we do a little deeper analysis. We look at not only your clinical symptoms and your manifestations, we have you fill out an assessment questionnaire, look at all of these symptoms. Are your hands, your feet cold? Are you intolerant to the cold? Do you suffer from vertigo and some of the tinnitus issues? Do you have chronic skin issues? Do you have chronic nail issues? Do you have chronic hair issues, chronic PMS? And all of these scenarios we try to engage from an assessment standpoint. Number two, we do a more in-depth look at your thyroid. Free T4s, which is raw thyroid hormone being made by the thyroid. Your body then converts in the periphery in your body, and in particular in the liver, to the more active metabolite, the more powerful. See, T4 actually that your thyroid produces is only a pro-hormone. It is a precursor. Where your body really wants to go, which is about 8 times as powerful, is to T3. Now that doesn't mean a whole lot to you, but technically it's very important that you know that, because most physicians do not evaluate that number. And that's really important, because if you don't evaluate that number, how can you really evaluate a situation? You say, well, don't they do other blood work? Yeah, they do TSHs. That's a message that's coming from your pituitary gland in the middle of your brain talking to your thyroid what to produce. But it's not always measuring the actual hormone that is circulating. What is my body using? Now, there are many interferences that can interfere with conversion of T4 to T3, which is why many folks look like they're okay from a lab standpoint, blood work, but physically don't manifest well. Toxicities, heavy metal toxicities, chemical toxicities, stress, high cortisol production interferes with conversion to the active form of your thyroid hormone. For women, estrogen dominant situations, birth control pills, synthetic and animal-based estrogens, or even if they're producing excessive amounts of estrogen because of weight and obesity issues, and they do not produce enough progesterone to counterbalance your estrogen, you have a dominant situation where estrogen is dominating, that can desensitize your thyroid hormone receptors, slow conversion. High cortisol, high stress hormone slows conversion of T4 to T3. So now I've laid that platform for you. So many folks, that third category that I wanted to focus on, subclinical hypothyroidism, meaning subclinical, it's flying beneath the radar, it's not being diagnosed. Folks are suffering of all the symptoms that I've named you, or maybe not all of them, but many of them. And also at the same time, they are told that they're perfectly fine and there's nothing that can be done for you. This is where we enter in with our naturopathic backgrounds, clinical nutrition, and yet our understanding of pharmacology is to then bring another thought process to the table. To say, let's work with a medical physician that will work with us, that will do a closer analysis of these labs, do some things from a holistic and naturopathic standpoint to encourage conversion, maybe some basic detox protocols, getting you on some core-based nutrients that encourage production and conversion. Evaluate your iodine status. Evaluate liver health and liver functionality. All of these things play a key role in making sure that we convert our T4 to T3. Certainly, I think that a lot of folks today are suffering unnecessarily. They have many, many symptoms that fit into a low thyroid type scenario. But they're not correctly evaluated, because most folks and most traditional medical physicians are not looking at the whole person. They're not looking at their stress cascade, how they eat, evaluating toxicities, evaluating hormonal balances or imbalances. And hence, in many cases, folks just feel really, really bad. They don't feel good. They're told their numbers are okay, their labs are okay. And this is where many folks are stuck in that third category, the subclinical hypothyroidism, experiencing all these symptoms from sluggishness to fatigue. I'm out of energy, my skin is dry, my hair is brittle, I've got premenstrual syndrome, and not that there are not other factors. We've talked about that in previous videos that we've done. But what we're here today is to really get you to start thinking about if your physician doesn't work with you. We have folks that we work with and labs that we order, etc., that would, I think, give a clearer picture in many areas. Understand that just because it doesn't show up the way, how shall I say, the way many physicians would expect it to show up in a set of labs, doesn't necessarily mean that it's not going on. Just because you don't manifest overt, horrible thyroid numbers in your labs do not necessarily mean that you do not have clinical manifestation of that. And so our goal and our role is to help try to elucidate that, to try to define that for you. Let's evaluate those numbers. Hopefully you've learned something today. I'm going to encourage you to go to our website at lenandjoe.com for further information. Tune into the radio broadcast. We broadcast daily. Go there and get the information. Also, on some issues with thyroid hormones, female hormones, you can go to mscompounding.com to get some more information, detailed information, what we were just talking about here. Thanks. Have a great day. Stay tuned for the next video.